But when it comes to children, I mean, it's very crucial. I can't stress it enough to people that if you have kids and you are on a well, have it tested because that's the only way that you're going to know what's going on with it, and know if there are any contaminants. So that's kind of how we do it about, or do it around here, um, and yeah.
Great answers, Allison. I'm telling you, you're doing better than you think. Being educated. Talk to me about yourself. How did you get to do what you're doing? What is your expertise? What's your background in this?
Well, actually, Dr. Siegel, I went to school for marketing, photography, and hotel restaurant industry management. And I've only ever really worked in the customer service industry or sales. And I moved back to Webster County about 4 years ago just to be closer to family and started working for the county in the auditor's office. And after some time, a position opened up in planning and zoning. So I moved down there to be the planning and zoning assistant. Um, just wanted something different, really have no background in that at all. And then about a year ago, one of my supervisors walked past my office and said, our current environmental health officer is leaving. Planning and zoning is going to absorb the responsibilities, and Allison, you're going to do it. And I said, okay. So it has been a learn as I go. I have had so much help from the DNR, Corey Frank and Eric Day and Amy Devereaux. She is with DMAC with the wastewater treatment program and classes there. Um, and they have been extremely helpful. I go to trainings whenever I can, and that's really kind of how it all happened, and just learning as I go.
Well, I got to tell you, this is you're going there under the Bellevue method. We learned at Bellevue Hospital in my training: see one, do one, teach one, and that's how medical training works. Although
Hmm.
you're not going to find me doing surgery. I'll tell you, we've had people on the show here that are not actually surgeons that do operate in Africa, but that's a whole nother story. But doctors have certain lanes we stay in, but
Hmm.
even within those lanes, there's a lot of learning to go on. How about let's talk a little bit more about these wells. Federal experts estimate that more than a fifth of private wells concentrations of contaminants above safe levels. Tell me more about the kind of contaminants we're talking about, and when do you get the EPA involved? When do you say this isn't a local problem? I need the Environmental Protection Agency involved.
I haven't got there yet. I hope to never get there. Like I said, I've only been doing this for a year. And here in Webster County, we test for total coliform, so bacteria, E. coli, nitrate, sulfate, arsenic, and manganese. Um, and eventually we will kind of expand on those testings, but just trying to build the program. So those are what we test for here. And the two biggest areas of contaminants that I see, just based on the first quarter of this year, were coliforms and sulfate. And the coliforms, those can be resolved by having your well shocked. And
Wait, what is
sometimes,
that? You anticipated my next question, which is how do
okay,
once you're cited, how do you fix it? So what do you mean having a well shocked? What is that?
it's shock chlorination treatment. So I strongly recommend everyone to use DNR DNR contractor to shock the well for them. They know what they're doing. Um, but you can always go to Menards or Lowe's or whatever local hardware store, and they have well treatment kits that you can buy. I don't recommend people to utilize those here in Webster County, but we don't have any requirements that you have to use a contractor to treat the well.